Well, good afternoon, everyone, and welcome to your monthly Citizen CPR Foundation Champions webinar. I'm your host, David Hiltz, and we have an excellent program lined up for you today. The mission of the Citizen CPR Foundation is to save lives from sudden cardiac arrest by stimulating effective community, professional, and citizen action. Through our community-based approach, the foundation intends to guide, empower, and enable communities to leverage 6 key strategies at the local and regional levels, including strengthening local stakeholder collaboration, encouraging data collection, analysis, and dissemination, facilitating the implementation of life-saving strategies, the promotion of public education and training, improving the delivery of high-quality resuscitation and post-arrest care, and enhancing the impact of cardiac arrest therapies. We are grateful for your contributions to the resuscitation community and for joining us in our life-saving mission. As your host and on behalf of the Citizen CPR Foundation, I would like to recognize and extend our heartfelt thanks to our industry partners for their generous support. Without that support, this program and our other efforts would not be possible. You know, have you ever wondered how to go about establishing an ordinance in your community that would require AED registration and inspection of devices during an annual fire inspection? Or have you considered introducing a bill that would provide support for your state to participate in the CARES registry? If your answer is yes, you've tuned into the right program. My co-host, Allyson Perron Drag, a government relations director with the American Heart Association and good friend, along with Professor Rob DeLeo of Bentley University, will be joining us for a discussion about the potential role of government in issues related to cardiac arrest, as well as advocating for related policy and regulatory change. We have a lot to talk about today, and we will get to Allyson and Rob in just a few minutes. As a reminder, please remember to mute your microphones and use the chat function to capture your questions during this webcast. We ask that participants be respectful at all times and refrain from sharing negative or degrading comments, as well as specific product and service promotions. Any images of products appearing in these webinars are for discussion purposes only and do not represent endorsement by the Citizen CPR Foundation. You know, do you have an announcement? If your organization is conducting an event or has a special announcement, let us know in advance and we can spotlight it for you and your organization here. I would like to encourage all of you to participate in the monthly Resuscitation Academy and Heart Rescue calls that are hosted by Dr. Tom Ray. These occur on the 3rd Thursday of every month at 4 p.m. Eastern Daylight Time. Anyone and everyone with an interest in resuscitation science and implementation should make plans and participate in this and subsequent calls as a matter of routine. Please look for a link specific to these monthly calls in your post-webinar email. And now to the focus of our program today: politics, public health, and shaping policy for improved outcomes. When we think of our role and the role of government in resuscitation, several things come to mind, such as disease surveillance, the regulation of healthcare providers, institutions, medical devices, and measures to prevent harm. But there is so much more. There are local ordinances, amending existing Good Samaritan statutes, 911 system reform, our EMS system, and more. Of particular note, The support of the 8 recommendations made by the National Academies of Science and the Institute of Medicine specific to sudden cardiac arrest, which include establishing a national cardiac arrest registry, fostering a culture of action through public awareness and training, the enhancement of capabilities and the performance of our EMS systems, setting national accreditation standards related to cardiac arrest, adopting continuous quality improvement programs, accelerating research and translation of science for cardiac arrest, as well as accelerating research on the evaluation and adoption of therapies, and creating a national cardiac arrest collaborative. Now, in reality, the process by which we advocate may be a bit more complicated than portrayed by Schoolhouse Rock. Just how does our government fit in, and how can we better leverage opportunities to work with our local, state, and national elected officials? To help us gain a better understanding, we are extremely fortunate to be joined today by Allyson and Rob. Both are celebrated advocate champions and are extremely knowledgeable and experienced in this area. This is a very important discussion. Allyson, I'm going to go ahead and hand the program over to you, and I'm truly looking forward to an excellent discussion. Please carry on.
Thanks, David. Thank you so much for having me. I'm excited about this. I'm very excited that I'm here with Professor DeLeo and that we can have this conversation. I'm going to start with, as a professor of political science, I'm sure, teach your students a lot about the appropriate role of government and why and when do we need public policy? When does that intervention happen? Why does it happen?
Yeah, that's a great question. And I'd be remiss if I didn't kick things off by just thanking David for having me on here today. I feel like I've come a bit full circle. In full disclosure, David's son, Ian, actually took several public policy courses with me at Bentley University, was one of the strongest students I've ever had. And he connected me with David and said, I see you do a lot of work on disasters and public health. I think you'd be interested in connecting with my dad. Fast forward a year or two, David became a regular guest speaker in my disaster policy course, where he pretty persuasively argued and underscored the extent to which cardiac arrest, much like the types of disasters that my course focused on, whether it was pandemic flu or airplane crashes or terrorist attacks or earthquakes, this is a legit crisis, although it doesn't get framed that way, certainly within some of the extant scholarship on emergency management, and admittedly, before he was coming to my class, by me as well. So it's great to be here, and thanks again, David, for having me. And I think that background really provides a useful context for thinking about the question you just asked, Allyson, and that is, so why government? What do we need this for? Why is it important? Why does it matter? Why not just rely on the private sector to do certain things, or why don't we just do these things ourselves and call it a day? And I think that there's really three pretty important reasons why we need government and we need public policy. One is government, above all else, is a way for us as a society to manage conflict, right? We can think of conflict as arising at a household level or a community level. We can also think of it as arising at the state level or national level. And what government at its core does is it provides us a system for effectively and hopefully efficiently managing those conflicts and creating resolutions in ways that are amenable to the most people. Maybe not everyone, but most people. Secondly, we need government because quite frankly, there's just certain types of goods and services that the private or even nonprofit sectors can't efficiently provide. It's hard to turn a profit on certain items, and so we can't necessarily rely on those sectors to provide them. These are what we call common goods, or goods that are shared by all of us as a community. And I would certainly put things like education and public health right in those categories. And then last, but certainly not least, we live in an unequal world. And I think that the recent COVID-19 pandemic really underscored and highlighted that for all of us, and something that I know all of you in the cardiac arrest community have been well aware of for a while. But we live in an uneven and unequal world. And when government works well, it helps to reduce those inequalities within society by making sure that resources are allocated to help mitigate some of those gaps in public policy and some of those inequalities. So why do we need a government? Manage conflict, reduce inequality, and provide some of those collective goods for us.
And as you think of that, especially around the kind of reducing inequalities, how do you think, an issue kind of bubbles up? You're in the debt, spend a lot of time looking at kind of disaster policy. How does that come to light? Is it because, there's a conflict that arises, as you're saying, more push for kind of the common goods, or, is it to kind of balance those inequalities? How does that, there's so many policies, there's so much good work. How does something kind of rise to the top? How does, people on this call who are advocating for something specifically, how do they get their policy to the kind of top of the list?
Absolutely. I love that. I love the way you framed it there. How do you get to the top of the list? In scholarly speak, we would call that agenda setting. So how is it that of all the different items that policymakers are considering at any point in time, whether it's climate change or education or inflation, how is it that the issue that you feel passionate about, in this instance, something like cardiac arrest policy, how do you get that onto the government agenda, which is actually really, if you think about it, Allyson, I know you're familiar with it, just getting on the agenda is the first step to change. A lot of people say, well, I really want to create this change in my community. David opened by saying, how do you change a local ordinance or state policy or national policy? Step one is really about just cracking that agenda and making sure that it's something policymakers are actually talking about and aware of, because there's a lot of issues that all of us in different policy domains or communities feel very passionate about, that just may not be on the radar of policymakers who are paying attention to a lot of different things. They're generalists, right? It's the only way that they're going to survive in their job. So I would say there's a couple things that really need to converge in order for agenda setting to occur. And I think some of these within the context of cardiac arrest policy are actually really important, and speak to some of the items that David listed as best practices from a policy perspective at the beginning of the call. So first and foremost, if an item is going to get onto the policy agenda, we usually need to have some sort of recognizable or compelling problem that draws policymaker, public, and media attention to a particular issue. So in his guest lectures, David often laments the fact that as a country, we don't do a particularly good job measuring cardiac arrest instances. And I would actually argue that from a policy perspective, that's extremely problematic for agenda setting purposes, because unless you can count something, unless you can point to what we call a validated indicator of the problem, you're going to have a really challenging time convincing policymakers that not only that problem exists, but that problem is worthy of their scarce time, attention, and resources. So if you think of other public health problems, I do a lot of work on emerging diseases. I've studied avian influenza and swine influenza and Ebola and even COVID. You know, our disease surveillance system isn't perfect. In a lot of cases, certainly fall through the cracks, but it's a pretty routinized system that gets filtered into the policy arena regularly. So if you're advocating for greater investment in public health prevention, you can point to changes in monkeypox cases or changes in COVID-19 cases and deaths as evidence that a problem exists. So in the absence of some sort of measure, that can be really difficult to do. Now, of course, numbers alone are probably not going to persuade policymakers, right? I'm sort of framing that as the first step. There's a lot of compelling problems that exist in our society, and there's a lot of data articulating those problems that policymakers continue to ignore. And here, we sort of shift from the realm of empirical measures to the way in which those measures get socially constructed and defined for policymakers. So as advocates of cardiac arrest policy, even if you have numbers showing that this is a really compelling issue whose time on the agenda is long overdue, you still need to make that case for policymakers themselves. So what do these numbers mean in their district? What do these numbers mean in terms of their impact on the lives of everyday citizens? What do these numbers mean for our healthcare system and health expenditures? You need to define and help them make sense of these numbers, because oftentimes their presentation of this change, this is the first time they've heard of it. And we call that problem definition, sort of the way in which we take a problem and define it for policymakers. Another thing that we need in order to get on the agenda is you could have a really compelling empirical measure. Allyson, you could do a great job convincing policymakers that this matters, maybe even illustrating its impact on their district, on their day-to-day lives. But policymakers are also going to be reluctant to act unless you offer them a solution to the problem. So, but in acknowledging that a problem exists, they also need to then at least entertain the possibility of coming up with a way to remedy that problem. So we could have instances, and it's not uncommon, where we have a very compelling problem, but there really isn't a solution to that problem that policymakers see as viable and see as something that they can get behind and support. And this can happen for legitimate reasons, meaning there really isn't a way to fix this problem at the moment, or it can happen because the solution runs counter to their interests. So I have a paper that I published on opioid policymaking that actually suggests there was a time where policymakers were reluctant to regulate certain prescription drugs, in part because they were worried about how that would affect the pharmaceutical lobby and how it would affect them electorally. So there needs to be a solution that they can sort of grab onto. And then lastly, there's other factors, but I think these are sort of the big three. As advocates of policy change and as scholars of policy change, we often want to make things highly structured and really systematic, that if all these things are met, then change will happen. And the reality is politics is messy, politics is unpredictable, and that means that we need to have organized interests. We need to have people like you, Allyson and David, who are ready to pounce when an opportunity exists for change. There needs to be a level of synchronicity. So I'm often reminded of the policymaker who maybe didn't think much about cardiac arrest policy, but then a young person in their district dies. Or the policymaker who maybe didn't think much about cardiac arrest policy until a family member or they themselves have an incident happen. You know, life is random and we can't predict when these horrible events occur, but they provide us with pathways and opportunity for learning. And so connecting those events to policy and showing them that, hey, you know, this incident that you saw happen in your district, this doesn't happen in isolation. This happens in a policy environment where we could do a little bit more. Allyson, I'm sorry to sort of turn the tables here, but I would be curious, can you think of any instances where maybe that happened in your own, you know, advocacy work, or does this sort of ring true?
Yeah, I mean, it definitely does. I definitely think, you know, in advocacy work, you really do need to come to elected officials, need to see the problem. If they don't see the problem, they're not going to want to look for that solution. And, you know, usually, you know, 9 out of 10 times the solution is a piece of legislation or a law to change that. I agree with you that you know, sometimes we come with just facts and data, and I think that that's important. But in cardiac arrest policy in particular, I think the stories are what moves people, right? For many years, I would almost say that Massachusetts has been a little bit behind in cardiac arrest policy. I hate to say that because that doesn't reflect so great on myself, but I think, you know, our policymakers have been reluctant, right? And we have seen other states, you know, kind of go far ahead of us. There are states that have, you know, many trained bystander CPRs that have defibrillators a lot of different places, collect strong data, you know, show kind of those results. And I think those are important, and I think people care about that. But I think when it affects them, to your point, when they see it, when it's somebody in their district or it's their family member or it's themselves, I think they have a stronger reaction to that. And so really making it, you know, taking those data points, showing them how, you know, that this tragedy and the number of cases that this affects and the results that could happen, but showing that picture, right? Having that, you know, that family bring in their son or their daughter and showing that, or meeting the person who survived because the right things were in place and how to expand on it. I think that's really important. And I think that what has made the difference as you think about across the country. You know, it is, to your earlier point, it is not equitable, right? We do not have similar cardiac arrest policies across the states. You know, there are communities that are stronger, there are states that are stronger, and it really has taken advocates to bring, here is the problem and here is the solution, and being sometimes the loudest and not going away. You know, I think our success in Massachusetts has truly been because we have advocates, citizens advocates who care about this, that's personal to them. And they have stood at those doors and they have shared those stories and they have not left because they have lost their kids, right? And they don't want someone else to lose it. And sometimes there are policymakers that it takes a little bit longer, but they hear that story multiple times. And so they can't look away, right? That they worry that it's going to be their kid or their neighbor or themselves. And so I think it is, you know, policy, as you had mentioned, can be frustrating. It is messy. It doesn't always go the way it should. It doesn't always equal well, this is the right thing. Here's the problem, and we have a simple solution, and you could do this really quickly. Policy takes a long time, and it takes a lot of convincing and a lot of work, and that can be frustrating for advocates. And so I would just say that, you know, continue to, you know, pound that pavement, knock those doors, tell the stories, bring new data, bring new stories, just keep making the noise is really what ideally lifts up the states that are kind of falling behind a little bit.
Yeah, I mean, because it almost sounds like if we take it from that perspective in your work in the policy space, of course, right? You have policy or issue advocates that are experts on that area that know a great deal about both the policy history of the space, as well as places that domain needs to go. But it's striking to hear you talk about pounding the pavement, because in that respect, if you think about cardiac arrest policy advocacy, you're amplifying the voices of the public, right? It's not as if you're making decisions on behalf in their stead, or you're amplifying those voices and those experiences that really truly exist, right? The data, it can be very easy to just look at the data as raw numbers, but each of those numbers is a human life. Each of those numbers signifies a family that was affected by this particular problem. Each of those numbers disrupted a community in ways that are immeasurable, right? And so when we think about what policy is, you know, we're just sort of the megaphone that's amplifying and drawing attention to these numbers, but they're real. They're not just data. They're so much more than that.
Yeah, and I think that's an important point. Like, how do you make that real, right? And to think about how do you make sure that you're taking those stories, right? What is political influence? What does that look like? How do you make sure you're getting to the right person? And I think that varies, you know, across the spectrum, whether you're talking about local politics or state politics or federal politics. But I'd be interested in kind of, you know, as you think through this, how do you identify that? How do you look at who yields and wields that influence and that power?
It's so challenging, you know, and I think that that's where, you know, I think that, you know, that's where in the US, we're so lucky to have a robust network of organized interests that are able to operate freely and advocate for policy change. Because, you know, for the average person, for me as someone who spends their life studying policy, identifying who has power when and how is really challenging. And I'll tell you why it's so challenging. So in simplest terms, we can think of someone's position as conferring to them power, right? So we know that the president of the United States is a very powerful person, right? We know that the governor of Massachusetts or any other state is a very powerful person. And we can also sort of look within different government institutions and say, this person may have power. So Allyson, you had mentioned you know, advocating for policy change in Massachusetts. Anyone that knows anything about Massachusetts politics knows the Senate president, the House Speaker, they're going to have a lot of say on what makes it onto that agenda at any given point in time. And so all of those like big ticket positions in government, there's power there. But you know, for most of us, our access to those power brokers, our ability to directly engage with those power brokers, it may be limited. And so we need to think a little bit more creatively about how we find inroads into government. And so I'll give you a couple insights into ways to do this and ways to identify power beyond just looking at, you know, who's the head of this particular institution. You know, one thing we often overlook is that power can be very contextual based on the policy area. So for something like cardiac arrest policy, there may be a particular committee within the state legislature or within your local government that has jurisdiction over this issue. So a healthcare committee or a public health committee, the members that sit on that particular subset of the larger legislative body, their position on that committee will carry a tremendous amount of weight because other members are going to see them as internal experts on it. So look for those committees that have jurisdiction, because that's where a lot of policy starts. The other thing I would say is that within an elective branch of government, you're also going to have individuals who will work for those legislators or city councilors who may be more receptive and able to engage with you on a day-to-day basis. So many state reps will have a chief of staff. Others will have an individual who will serve as sort of an ombudsman between the office of that elected official and the district. sometimes we think, well, they're not the decision maker. What influence do they have? There's a lot of literature suggesting that elected officials delegate a lot of decision-making authority to them and really take their advice to heart. So sometimes, even though you're not directly talking with the elected official, those non-elected members of their staff can be hugely influential and important. And now one other thing I would add here is, although we're talking about public policy, and I would be remiss as someone who teaches public policy at a business university if I didn't note that policy and political influence doesn't only flow through government. So there may be members of a policy community, say a doctor who's world-renowned, someone who represents an advocacy organization, even someone who is well-known in your local business community, that have the ear of policymakers and are able to exert a tremendous amount of influence, even though they're not elected. So understanding that power exists both within and outside government can be a great way to begin to identify and think about power.
Yeah, I always say staff is so vital, right? Like,
cool.
People get upset when they meet with staff and not their elected officials. I will tell you that staff tends to know the issue a little bit better and wields great influence with their elected officials. And again, I would say, like, as you're thinking about this, and as Rob mentioned, like, power map, do kind of, look at who influences them from the community. You'd be amazed at kind of your connections in terms of what organizations are they part of? Did they attend, the same university as you? Do you, know their kids? And really kind of looking into kind of what we would call like a pathway of influence. How do you know how to get there? And different legislators, constituent voices really matter, or those, issue area experts really matter, or, if the lobbyists make a difference, or it really depends. And so kind of taking the time to figure that out, I think, is really important. And I noticed there was a piece in the chat from Janet who said, as a former elected official, sometimes the frustration is that you can really, be there and care about the issue. But if you're the only one kind of carrying the water, that's really hard. So I think as advocates, it's really important that you surround your legislative champions with help, that sometimes it's a numbers game, right? Like if like in Massachusetts, if the Speaker of the House or the Senate President, they like it, but they're not sure where their members stand, it's the job of the advocates to really kind of get as many members going in there to say, when are we doing this? When are we doing this? So Janet's not by herself, the only one knocking on that door, because I think that's really hard, right? So really making sure you have, strong collaboration, that you gain a lot of support from that. And that really helps, sometimes power in numbers, means a lot on that. So
that's great. I mean, that's such an important perspective. And I Janet's point is very well taken. I'm actually going to, hopefully we'll circle back to that later, but it also reminds me that, elected officials, their staff, they're people, right? And I think that there's also, we tend to forget that, of course, we should go to them and advocate for things and make asks and not feel shy about making requests. But there's also a relationship building element to all of this, right? Just as David and I, had to get to know each other over a couple of years before he invited me to the webinar, so too, is it important to cultivate relationships with these people? And I think that when those asks come organically out of a relationship, that can be more powerful. And I would agree, it's wildly frustrating when you want something done yesterday to have to wait. But so much of change comes from those informal networks and relationships. So it's really cool hearing you say that, Allyson.
Yeah, and I think, to kind of jump off of that, a lot of people, to your point, are kind of worried about, going to their elected officials, making their ask. And in particular, I think there's some disillusionment with elected officials, right? will they care about this issue? Will they really be able to do something? You know, will that one person matter? Will my push on my ask on this or my vote, will any of that matter? And I think, you know, there are good examples of saying yes, but, you know, I'd love your thoughts, Rob, to think about, like, how do you, in this frustrating world and where it looks a lot of time that government is not as efficient as it should be, or that things don't work as well as they should, what should motivate people to still try, to still advocate, to still take and stand up and make that ask? I think, you know, be helpful for people to know.
Oh, this is such a good question, Allyson. And it's, you know, we're at August 9th. This is about the time that every faculty member in the greater Boston area has a crisis where they realize they're like a month out from school and they need to think and prep for their classes. And this is a question that this year in particular has been front of mind. And that is, you know, polling tells us that we have record distrust in government, that people do not think very highly of elected officials and government in general, and that people are really disillusioned with government. And, you know, to be quite frank, there's times where I think I'm guilty of this in my lectures, of presenting an overly cynical or critical view of government and what its capacity is. And, you know, in thinking about this issue, a quote came to mind, and I know it's a little cliche and gets used an awful lot, but it's from former House Speaker Tip O'Neill, and it is, "All politics is local." And I often have sort of unpacked this and tried to think of, well, what did the speaker mean by this? Did he mean by in order to win, he needs to run locally? Does it mean you got to disseminate pork back to your district? What does this mean? Or does it mean we shouldn't worry about big national issues? And the thing I always come back to is, at the end of the day, we're the ones that are conferring power to elected officials. We're the board of this system that we call democratic governance. So at the end of the day, members are going to be eager to engage with and please their constituency. I think the problem or the breakdown comes when we as constituents have really, really busy lives. We have a lot of things that we need to attend to, and we don't clearly and effectively communicate those concerns to our members and indicate to them that, hey, this is something that we really care about, right? We see this play out all the time, where polling will suggest one thing, and then an election will show that, wow, we were way off. We really didn't, you know, have a great sense of what the people wanted. In Kansas, most recently, where voters rejected a ban on abortion, you know, that's case in point of, you know, the voice of the people matters. So I think that while I'll concede that the further up you go in government, the harder it can be to get the ear of elected officials. You know, your local and your state officials, they're eager to find ways to work with you. And it doesn't mean that, you know, your rep is going to be able to pass, you know, multi-million-dollar cardiac arrest policy, you know, overnight. But what it does mean is they're generally going to want to do things that their constituency will reward them for. And part of those rewards are showing up to the polls and making sure that they stay in office. So I think there's a lot of space to engage with government, and I think they're still eager to work with us more.
Yeah, and I would just say, I would add, you know, because you said something about people's busy lives and pieces on this, and thinking sometimes that maybe it doesn't matter. Sometimes a lot of people will think, well, somebody else will do that. And I would just encourage you, if you see a problem and you know the solution, that you should speak up, because your voice does matter to the elected officials. It really doesn't take, you know, 1 million people or even 1,000 or 100 people. It takes just one person to bring up an issue for an elected official to think that might be something I want to work on. And maybe it's not your elected official, but there is an elected official that will care about this. And so keep trying. That's what, you know, I think for that is like, just don't think somebody else is going to talk, because that's what everyone could be thinking about. So
yeah, I agree. And, this is an anecdote, from a personal anecdote. I had a parent that was a state representative in Massachusetts who eventually became the Speaker of the House. And I actually recall spending a weekend with him, and he pulled out a large manila folder with documents in it, what looked like documents. And I said, what do you have there? And what he actually had was printed out versions of every email he got from his constituents over the last week. And, I always sort of knew he was engaged in following what his constituents want, but, these are things that elected officials pay attention to. When you send that email off, any legislator who wants to remain in office is going to at least hear you out, and again, they're busy. They're pulled in a lot of direction. I mean, he certainly was as Speaker, but they're still paying attention to what's happening at the district level, because without that district support, your days will be numbered as an elected official.
yeah, because I think to go on that, you may be Speaker of the House and that might yield you more power and influence, but you still need to bring stuff back to your district, and your constituents still matter. And I think, there's some elected officials that do strong constituent services who print that email off and write the note back and do that, right? And as constituents remember that, right? They remember good constituent services. And, those that don't think constituents matter will not be there that long. I can guarantee you that. So I would say,
agree completely.
in particular.
I
I mean, I think as you think through kind of, where we're at, and you have very strong kind of ties within kind of disaster relief. We looked at kind of the COVID-19 pandemic and kind of how did we, kind of ignore disparities in public health, and what can we do now to, I got dark for a minute there. There you go. We're in the middle of a thunderstorm, so I apologize for that background noise. And and kind of what are some of those pieces that you're looking, as you think about the disparities in public health, and has it worsened, and what should we do around that? How do you advocate for that?
So I'll say that, as a scholar, I've had the privilege of spending the last couple of years actually studying COVID-19 with some outstanding public health practitioners and scholars who have actually been doing work on healthcare disparities for quite a while. And one of the things I would say is that I think that the COVID-19 pandemic underscored, and for some people maybe revealed that disparities exist, but I don't think these disparities were new, right? I think that actually institutionally, they were quite long-standing, and that they were in place for quite a long time. It just took the largest crisis of our lifetime for us to really open our darn eyes and recognize them. So I think the question thus becomes, now that we recognize them, where do we go from here to make sure that they're not forgotten? And I would say from a public policy perspective, I think it's important that we engage with communities who may have been historically, institutionally, and quite frankly, systematically marginalized from the policy process. So we talk about the challenges of engaging with policymakers. For those of us who have 9-to-5 jobs, there's ample data to suggest that those challenges are doubly so for individuals who have been historically discriminated against or marginalized from both the voting process, let alone as well as the legislative process. So really thinking carefully about our own positionality and where we as advocates fit in, and how we can look for ways to explicitly and directly engage with those voices who may not be there, I think is like step one. I don't know that you can make good, sound public policy without ensuring that everyone is represented, that everyone has a seat at the table. The other thing I would say, and this gets back to the issue of measurement, it's one thing to measure cardiac arrest policy, and Allyson, I'll actually have turn this around as a question for you as well, but it's also to look at not just what are the incidents, but who are those incidents affecting, right? So when we dug deeper on some of that early COVID-19 case data, we saw that it was members of our Black and Brown communities that were really being impacted the most and were having some of the highest lethality rates. So looking at why is that? Why do these disparities exist? Is it about access to certain medical care? Is it about ability to stay home and not go to work during a pandemic? Is it socioeconomic disparities? Really treating data as something that needs to be looked at granularly is critical to understanding those disparities. I'd be curious, Allyson, have you observed similar patterns in the cardiac arrest space with respect to disparities?
Yeah, I mean, we've been talking within cardiovascular health for years around the disparities and then inequities. And some of it is definitely around the access issue, right? Having the, access to affordable care and quality care. But some of it is really about the environment in which they live, right? That they work jobs and they can't eat healthy and they can't do things. But we see in particular lower rates of bystander CPR performed on Black and Brown people in, communities. The rates across communities in Boston vary based on, kind of which neighborhood you are in, right? And so, and in particular, you could be, less than a mile apart and your life expectancy can be dramatically different. And so, I am hopeful that, there was a larger light shown with the COVID pandemic, the inequities and the disparities, and that we have an opportunity to tackle that. I am, a little bit wary in terms of how much we will want to tackle. I think to go back to a question that Lee put in the chat, policymakers have a hard time looking at long term, right? They like to see that immediate change in the time frame where they legislate, like whether that's a year, 18 months, 2 years. They don't always want to know, well, cost savings 10 years down the road or 20 years down the road. I think for us in particular in kind of cardiovascular health and cardiac arrest situation, the results turn really fast and that helps us in our advantage. And so if we can show that and collect that data, to go back to an earlier point to David saying, how do we get a CARES registry in place where we have all, data kind of put in one place? I think that that's important to think about so that you can show that quick turnaround so that they can see why you want to do this, why it's important. And we have to kind of take advantage of that. How do we make sure we put people on the ground that can immediately, kind of react to bystanders? I think there was a question earlier from Paul that was saying, let's not just rely on the people whose profession this is or that come from the agency. Let's make sure that we're really empowering folks that, we can get out there in the community that feel comfortable, that know where the defibrillator is, know how to do CPR and have that reaction. And I think those kind of pieces hopefully can start to look at those inequities and start to kind of close the gap that's needed to be closed so that we have those better outcomes and we're not seeing such poor results in our kind of brown and Black communities.
Absolutely. I completely agree, right? It's like it's one thing to recognize it. It's harder to sustain and really do the work. And I think that to the point the last point that you raised around let's not just wait for policymakers. I couldn't agree more. So I have a colleague, Daniel Aldrich at Northeastern University, who does a lot of work on social capital and disaster response. And one of the things that Daniel has found is that you can look at lives saved after disaster in terms of, did the community have a preparedness plan in place? What were the mitigation measures that were adopted? How much money did they spend on disaster preparedness? But actually the best predictor of whether or not people will survive in the immediate aftermath of a disaster is their degree of social connectedness and social capital, meaning how well empowered are these people to respond in near real time to the immediate needs of their neighbor. Because if your house is flooded, FEMA might not get there for days, right? If you're an elderly person who lives alone in the middle of a pandemic, no one may check in on you for weeks. So if you have neighborhoods, groups, constellations of people who are empowered and trained to act and respond, your ability to weather that disaster, whether it's a flood or your grandfather or your cousin suffering from sudden cardiac arrest, your ability to bounce back is going to be a lot quicker, right? I mean, one of the things David stresses is every second after cardiac arrest counts. So we can't strictly delegate this to public health officials or even local EMS. We all need to be empowered, and we have to have a high degree of social capital to do that.
Wow, what a great discussion. Like, when you do these shows, you go, whoa, what are we going to talk about for an hour, right? And here we are, we're like, out comes a shepherd's hook. And we're just getting started, right? So I want to pause here and allow a handful of questions and hopefully answers. And then like some reflections from you, Rob and Allyson, and I'll look to wrap things up and send us all on to our next destination. So, Janet, would you have something to say? If you do, let's come off mute and let's hear from Janet in the great state of Montana.
Hello, everyone. Yeah, I think that everything you guys have said is from being on both sides of issues, this issue, it's just really incredibly important that you build some capital with people. When I was on the city council, that was always a thing, is that you'd have these people come up and talk to you or send you an email or call you out of the blue, and you had no idea who they were, if they were legitimate or they were, and that's why I say, getting access, and I guess that's maybe not a great word, but being in those same kinds of community groups that the movers and shakers in the community are involved in, really helps give you some credibility and gives you that, like you said, that personal connection, so that you know that this person is, someone that you want to listen to. And at the same, and then on the reverse side of that, always getting to know people. And Montana is really very unique in that we are a huge land mass, but we're a very small state. And so we know our elected officials on a first name basis. We know who their staffers are, and that really helps, to be able to, I've got phone numbers for staffers, and you can call them and say, hey, this is
interesting.
Yeah, I mean, Montana is very, very unique in that. I mean, with only a little over 1 million people, if you want to be involved in political activities, it's not hard, and you can very quickly get to know, from city council on up, school boards on up. That's one of the things that that wasn't mentioned. And I think, when we're talking about sudden cardiac arrest and things related to AEDs, another really good place to start is with your school boards and your schools. And then you get 2 or 3 people that are, because I know, at least here in Montana, school board members belong to a statewide organization. And so they talk about these things at the statewide level, and they have some clout then to take things to the Board of Ed and to the legislature. And we did get a bill passed that every school in Montana has to have an AED. And so, but it was by working through the school board association. So schools are another really powerful powerful group.
Janet, I think that that's an important point. I think to go back to Rob's point is all politics are local. Sometimes it really helps to start at that really local level. So the school boards, your selectmen, your city councils, and have some towns, do this and then have them kind of go up, right? Whether that is to the state board, to their association, and then it kind of expands. We have found a lot of success by doing kind of local policies and showing that, that school didn't have fall apart when they put the AD in, right? Like I remember people thinking that kids were going to take them off the wall and shock them, right? Like, so showing that it works and showing that they can do it, at the right cost, and they can really protect their own community, and then it kind of bubbles up. Sometimes you need to go from the bottom up, and sometimes policy starts at the top of the level. And so I think it's really important to think about, in terms of where's the best place and where do you have your influence? I think to go back to an earlier question, is that influence with that school board where you have a kid in that school and that your voice as a parent holds a lot of weight. So I think that's really important. Thank you for sharing that.
Yeah,
and I'm happy
I would add,
Montana has all schools have defibrillators.
I would add one thing. I think, Janet, your points are so well taken and so incredibly insightful. But, as a former elected official, you also, remind us that, an elected official is a vote of one, right? And it's one thing to get their ear, but you need to understand that they need to then build a coalition within whatever elected body or non-elected body, because regulatory change is about coalition building as well. So what I often advise students and colleagues is, sure, you can go to an elected official and say, here's this brilliant piece of legislation that you should support. And that's great. That's a good first step. But it's a lot more powerful if you go and say, I have this legislation and it's already endorsed by this teachers association, your colleague from the neighboring district, these small businesses within our community, the head of the school board, whatever it is. If you can start to build that coalition, you're signaling to that legislator that this is something that may have legs and be able to run with a little bit. So I think it's a great point that you raised, Janet.
All right. So here's where I, as the host, say, oh my gosh, where did the time go? Rob, Allyson, participants, an extraordinary discussion, one that needs to continue, right? And so if I were to wrap up, and I'm going to, right now, I would say, there's so many salient points that have been made this afternoon. I don't have time to cover them all. However, I would say a couple of things. Do not accept defeat, right? Getting to Allison's point of how long and difficult policy change is. I'd use our own experience with 911 reform in Rhode Island as an example of where it took decades to get the job done. But we didn't accept defeat, right? Be able to articulate the problem in a manner that is palpable, okay? Data driven, okay? And not only do you present the problem, but you present a solution as a group, and that the importance of working in a coalition and collaborative manner has never been more important than in this particular case. Within the recommendations that the Citizen CPR Foundation makes regarding community-based approaches to improving outcomes, says don't go and try to do this on your own, because not only are you identified as, a lone heretic and easily dismissed, but you really lose out on the power of collective strength. And so, I think Paul mentioned, Nick of Time Foundation. There are small foundations all over the place, but yet we haven't been able to figure out how to better or most efficiently band together for policy change. And so I think there's a bit more work to be done. But on behalf of the Citizen CPR Foundation, the board of directors, all of our participants, me, your friend, I'm entirely grateful. Heartfelt thanks to both of you. Now, everyone, as we sign off, please join us next month when we will discuss ideas for action related to World Restart a Heart Day and the concept of Shocktober, right? October is Cardiac Arrest Awareness Month, and October 16th is World Restart a Heart Day. So we'll spend a little bit of time talking about that on our next show. As we conclude our program this evening, I remind you to please let us know how we can do better. We would like to hear of your feedback and ideas for monthly webinars. These webinars are for you and your communities. I am David Hiltz, signing off, and good night.